Have you or someone that you know developed unusual symptoms after getting the COVID-19 vaccine? It could be joint pain that doesn't go away, unexplained fatigue, rashes, or tingling and numbness in your body. And now are you wondering if those symptoms are the signs of an autoimmune disease? Stay here because today's video might connect some dots for you. In this video, I will discuss about can COVID vaccine cause autoimmune diseases? What happens if you have an autoimmune disease and you get the COVID vaccine? And I will also share with you some practical tips that you can apply today. Hi, I'm Dr. Diana Garnita, a board-certified rheumatologist with a PhD in immunology. And I treat patients with autoimmune diseases and arthritis every day. Wow, what a journey we have been through since COVID first hit us in 2019. Now in 2025, we are finally understanding some of the long-term impacts of the virus and the COVID-19 vaccine, especially in people with autoimmune diseases. In my previous video, I explained the effect of COVID-19 infection regarding the link with autoimmune diseases in those people who are at risk of developing autoimmune diseases and what happens in people who don't have an autoimmune disease but then they develop the infection. In this video, I will discuss more about the COVID-19 vaccine and if it may or may not cause autoimmune diseases. But first, let me explain to you how vaccines work and what do we know in general about the risk of causing autoimmune diseases. So vaccines provoke our immune system to respond to specific proteins that are part of the virus. And in this case, in COVID-19, the spike protein. And those vaccines are supposed to teach our immune system to recognize and fight the actual virus when they will encounter it later. And to make this training even more effective, in the vaccines there are introduced adjuvants. But research shows that in some people, especially those people that are more prone to autoimmune diseases, these adjuvants and not necessarily the protein from the vaccine will trigger our immune system and could lead to an autoimmune disease. COVID-19 vaccines were reported to cause many skin reactions where you get the injection. But in some cases, the skin reactions were autoimmune in nature. And research showed that some patients develop skin diseases like vasculitis or lupus. While COVID-19 vaccines were considered generally safe, it is essential to understand that there are some rare side effects that have been reported. Severe anaphylaxis reactions were reported in some cases, so that's why CDC recommends to have pre-filled epinephrine syringes available in those sites of vaccination, and they do recommend to keep people under observation for at least 30 minutes after they receive the vaccine. There were other documented rare side effects that included mild myocarditis, which means the heart inflammation, autoimmune conditions such as thyroid disorders, blood disorders, autoimmune hepatitis. In one case, it was observed reactive arthritis, and in some cases, neurological reactions such as Guillain-Barré syndrome. These side effects were reported rarely, and mostly they resolve with proper medical care. This information comes from published medical data, but new findings continues to emerge, so we have to stay on board with that. Now let's discuss something crucial, something that many of my patients will ask me. If you have an autoimmune disease, should you get the COVID-19 vaccine? First, let's consider the hard facts. If you have an autoimmune disease, your risk of getting COVID-19 is double when compared to general population. And there is a reason for that. You are at high risk because many of the patients with autoimmune diseases, they take medications that will affect their immune system, that will depress the immune system. Medications like methotrexate, leflunomide, biologics, or JAK inhibitors. Now, autoimmune diseases itself can make you more vulnerable to get infections. And on top of that, if you have more medical visits to the office, that will increase the risk for you to get exposed to other people around you that will make you sick. And that is why I'm a big proponent of telemedicine visits. When I started my company, Rheumatologist on Call, I did not know that COVID pandemic will hit us. But it was the best thing that ever happened to people who suffer from autoimmune diseases, and they were under my care. They did not have to travel, or they did not have to wait in a waiting room to expose themselves to others and in this way get the COVID because they just had to wait in a waiting room. Now, if you are over 50, if you have obesity, diabetes, high blood pressure, if you have heart or lung problems, that will also increase your risk to develop a more severe COVID-19 infection. If you have lupus rather than rheumatoid arthritis, you also tend to have a higher risk to develop COVID-19 complications. Now, in comparison, patients with Sjogren's disease or systemic sclerosis had a better prognosis. Now, if you take certain medications like high-dose steroids, some biologics like rituximab, you will be at higher risk to get the infection, and you will be at higher risk without the vaccine. So that questions that many patients will ask me, should you take the COVID-19 vaccine if you suffer from autoimmune disease? So the answer is yes, because if you have an autoimmune condition, the benefits of getting the vaccine typically will outweigh the risk of complications. And as we discussed so far, the autoimmune disease patients are more likely to develop severe COVID-19 complications. But here is the tricky part. You need to time it right to get the best protection. And the best time to get vaccinated is when your disease is quiet or in remission, when you are not fighting any infections, and when you are at least 2 weeks apart from another vaccine. But how about medications? Will medication affect your vaccine? Yes, if you are on rituximab, you should get the vaccine 1 month before you start the infusion, or wait 6 months after your last dose of rituximab. If you are on high-dose steroids or about to start biologics, you should talk to your doctor and find the best timing. I always recommend to my patients to get vaccinated before they start biologic medications. But don't forget about other vaccinations like flu or pneumonia vaccines. You just have to space them out from COVID-19 vaccine by at least 2 weeks. The bottom line is that while we are still learning about COVID-19 vaccines, we do know that generally they are safe for people with autoimmune diseases, and they could protect you from severe COVID complications. Now, as I promised to you, let me share 5 practical tips that can boost your immune system during COVID times. And as a physician treating patients with autoimmune diseases, I have seen these strategies making a real difference. Tip number 1, immune boosting vitamins. Let's make it super simple. You have to take vitamin D, vitamin C, and zinc, and you can combine all of this into a supplement and they will help your immune system. Tip number 2, gut health boosters. Believe me, your gut health affects your immunity. And what should you do? You can start your day with a probiotic, you can eat yogurt, you can fill half of your plate with colorful vegetables, you can add berries to your breakfast, and skip that wine with dinner because alcohol will disrupt your gut healthy bacteria. Tip number 3, better sleep habits. Make sleep your priority. And with that, I'm telling you to set up a bedtime alarm, not just a wake up alarm. Turn off all the screens 1 hour before you go to bed and keep your bedroom cool and dark. Tip number 4, easy movements. No gym is needed. You can start with 10 minutes morning stretch. You can take walks during the time that you answer phone calls. You can park farther from the store entrance, or you can take the stairs when possible. And tip number 5, your stress busters. So a quick way to lower your stress is to take 5 deep breaths before checking emails. Call a friend every day and take regular breaks outdoor. And what to avoid? Avoid smoking, because smoking, it will decrease your immune system and it will actually increase the risk to develop a severe COVID infection. But remember that these changes work best when they are combined with your regular medication, and I want you to think about them as extra protection. And very important is to stay connected with your doctor, to work with your rheumatologist, because everyone's autoimmune journey is different, and what works for you might not work for another person. My patients, they do discuss with me all their concerns, and I always create a personalized approach for them. And now that you've learned so much about the COVID-19 vaccine, there is so much more to learn, and I invite you to watch this video where I will teach you the top 10 signs of an autoimmune disease.